Osteoarthritis and rheumatoid arthritis are often mistaken for one another. So how does your doctor tell the difference?
Dozens of diseases can imitate the symptoms of rheumatoid arthritis or RA. Osteoarthritis or OA is the most common form of arthritis affecting more than 20 million Americans. OA and RA are often easy to mistake for one another, but OA is less destructive and may not require the same aggressive treatment. So how does your doctor distinguish RA from OA? Swelling of the joints in OA feels hard and bony, while swelling from RA is soft, warm, and squishy. Stiffness is very common in RA, especially when you first get up. RA stiffness may last several hours in the morning and slowly go away with light movement. But in contrast, the joint stiffness occurs less frequently in OA and tends to arise in the evening and worsen with movement. Morning stiffness is uncommon with OA, and when it does occur, it lasts only for a few minutes or so, but definitely less than 30 minutes. RA and OA affect the body and the joints differently. RA tends to be symmetrical, affecting the same joints on both sides of the body. OA and RA both affect the hands, but they tend to affect different joints. RA tends to affect the knuckles at the base and the middle of your fingers, while OA affects the ones in the ends of your fingers and the parts of your wrist that is nearest to your thumb. Pea-sized rheumatoid nodules under your skin are a sign of RA. These nodules only occur in about 20% of RA patients. Lab tests and x-rays are another means of differentially diagnosing RA and OA. With RA, your blood test lab results may show the presence of a substance known as rheumatoid factor. Results may also indicate an elevated level of a specific protein known as acute phase reactants. In OA patients, acute phase reactant levels tend to be normal and rheumatoid factor is rarely present. Through x-rays, your doctor will look at your joints. People with OA tend to have narrow spaces between the bones. Those with RA may have rough or damaged places at the ends of the bones, or cysts or fluid sacs in the joints between the bones. RA and OA are distinct diseases, and each requires its own unique treatment and management regimen. Therefore, a clear distinction between these diseases and a differential diagnosis ruling out one disease over the other are supremely important to receiving proper treatment. Be sure to share all your symptoms with your doctor and answer all questions as clearly and as precisely as you can.